Parecoxib is a non-steroidal anti-inflammatory drug NSAID with analgesic pain-relieving properties. Its pharmacology involves several key aspects. 1. Mechanism of action. Parecoxib primarily inhibits the enzyme cyclooxygenase to COX2. COX2 is responsible for the production of prostaglandins, which are chemical messengers that play a role in inflammation and pain. By inhibiting COX2, Parecoxib reduces the production of prostaglandins, leading to decreased inflammation and pain. 2. Indications. Parecoxib is typically used for short-term pain relief, such as in the management of postoperative pain or acute pain conditions. 3. Route of administration. It is often administered intravenously or intramuscularly in clinical settings. 4. Metabolism. Parecoxib is rapidly metabolized in the body to its active form, valdecoxib. Valdecoxib is also a COX2 inhibitor and contributes to the drug's pain-relieving effects. Intravenous for dosage. For the management of postoperative pain, a common initial adult dose is often 40 mg of Parecoxib given by IV injection. This initial dose may be followed by additional 20 mg doses at intervals as prescribed by your healthcare provider. Intramuscular IM dosage. The intramuscular dose of Parecoxib can vary based on the specific surgical procedure and the individual patient's needs. Your healthcare provider will determine the appropriate dose and frequency of IM injections. Parecoxib, like other non-steroidal anti-inflammatory drugs NSAIDs, can have side effects. While not everyone will experience these side effects, some of the most common ones include 1. Gastrointestinal effects, stomach pain or discomfort, nausea, indigestion, diarrhea, gas or bloating. 2. Injection site reactions for intramuscular administration, pain or tenderness at the injection site, redness or swelling. 3. Headache. Some individuals may experience headaches as a side effect of Parecoxib. 4. Dizziness. A feeling of lightheadedness or dizziness can occur in some people. 5. Elevated blood pressure. Parecoxib can cause an increase in blood pressure in some individuals, so blood pressure should be monitored during treatment. 6. Skin reactions. Although less common, some individuals may experience skin rashes or itching as a side effect. 7. Gastrointestinal ulcers and bleeding. While less common, NSAIDs like Parecoxib can lead to more serious gastrointestinal problems, including ulcers and bleeding. It's essential to seek immediate medical attention if you notice symptoms like black, tarry stools, or vomit that looks like coffee grounds, as these could indicate gastrointestinal bleeding. 8. Cardiovascular effects. NSAIDs, including Parecoxib, have been associated with an increased risk of cardiovascular events such as heart attack or stroke, particularly in individuals with pre-existing cardiovascular disease. 9. Kidney problems. NSAIDs can affect kidney function, leading to potential kidney problems. Signs of kidney issues may include changes in urine frequency or color, swelling, and increased blood pressure. Parecoxib, as a non-steroidal anti-inflammatory drug NSAID, can interact with other medications and substances, potentially affecting their effectiveness or increasing the risk of side effects. Some common interactions to be aware of include 1. Other NSAIDs. Concurrent use of Parecoxib with other NSAIDs, such as ibuprofen or naproxen, can increase the risk of gastrointestinal bleeding and ulcers. It's generally advisable to avoid using multiple NSAIDs simultaneously. 2. Aspirin. Combining Parecoxib with aspirin can also increase the risk of gastrointestinal bleeding. Aspirin is sometimes used for its antiplatelet effects to reduce the risk of blood clots, but the combination with Parecoxib should be carefully monitored. 3. Anticoagulants and antiplatelet drugs. Parecoxib may enhance the effects of anticoagulant medications, blood thinners, like warfarin, or antiplatelet drugs like clopidogrel, which can increase the risk of bleeding. 4. Corticosteroids. Concurrent use of Parecoxib with corticosteroids may increase the risk of gastrointestinal ulceration and of bleeding. Patients on both drugs may require additional monitoring and gastroprotection medications too. Protect the stomach. 5. SSR is and SNR is. Combining Parecoxib with these types of antidepressants can increase the risk of bleeding, including gastrointestinal bleeding. Close monitoring is necessary if these medications are used together. 6. Diuretics. Parecoxib can reduce the effectiveness of certain diuretics water pills like furosemide. Your healthcare provider may need to adjust the dose of diuretics if you are taking Parecoxib. 7. ACE inhibitors and angiotensin to receptor blockers ARBs. Parecoxib may reduce the effectiveness of blood pressure medications like ACE inhibitors and ARBs, potentially leading to elevated blood pressure. Blood pressure should be closely monitored when these drugs are used together. 8. Lithium. Parecoxib may increase the levels of lithium in the blood, potentially leading to lithium toxicity. Blood lithium levels should be monitored closely if you are taking Parecoxib while using lithium. 9. Methotrexate. Parecoxib can increase the blood levels of methotrexate, which may lead to an increased risk of methotrexate-related side effects. Methotrexate dosing and monitoring should be adjusted accordingly.